Walking around with the mic. Welcome, everybody. Thanks for joining us. I'm Irina Yen, Director of Penn Wharton Entrepreneurship, and I'm also an alumna of Penn and of Wharton, based out here in San Francisco. For those of you joining us for the first time, Wharton Scale School, as you read on the invitation, or if you've been reading a little bit more about it, is an initiative that we started just this year. And the series of workshops focuses specifically on the solution to challenges that rapidly growing companies face. So this is beyond the product market fit stage. These are for companies who are trying to understand how to handle the critical challenges of a large enterprise as they try to grow into becoming a large enterprise. So Penn Wharton Entrepreneurship, Lifelong Learning, and Wharton's Customer Analytics Initiative has partnered to host tonight's Scale School. We're really lucky to have tonight with us the Alumni Affairs and Lifelong Learning Director, Jane Simons. Jane, are you in the room? Right there in the back. Welcome, Jane, and thank you. Wharton Customer Analytics Initiative Executive Director, Colleen O'Neill, right there here in the front, and Rachel Dirksen, Associate Director of the Analytics Initiative, and of course, Eric Bradlow, who will be joining us in just a few minutes. And especially want to acknowledge Director of Special Events, Allison Grant, whom you all met outside in the front as you entered. So given Wharton's heritage, it seems fitting that we're here today. Analytics and the idea or the notion of a data-driven narrative has long been part of Wharton's heritage. For those of you, in the vintage years as I come from, can remember back in the day when it was decision sciences, right? So it's been a long heritage here in Wharton, and we're hearing a lot more about the word analytics in general in business today. But we've been there, done that for a while now, haven't we? So a little bit about tonight's program. We're going to start off with a case study led by Wharton alumnus Ethan Prater. And that will be followed by a moderated discussion that Professor Eric Bradlow will be leading for us tonight. As you know, Professor Bradlow is also the faculty director of the Wharton Customer Analytics Initiative and also the chairperson of the marketing department. So now a little bit about Ethan. So Ethan Prater is an entrepreneur with deep expertise, operational expertise, and leadership experience. He is an independent advisor. He's a board member, a consultant, and investor, with focus on software product management and analytics, the majority of which happens to be in healthcare, education, and marketing. So I mentioned operational expertise. He's got a lot of experience. He's the chairman of the digital health track at Alchemist Accelerator here in Silicon Valley. He served as CEO of Novo Ed, this SVP GM of Consumer Engagement at MDion, now Change Healthcare, the VP of Products at Castlight Health and Jigsaw, now Data.com at Salesforce.com, and also the Director of Product Marketing in Advertising, Targeting, and Analytics at Yahoo and DoubleClick. Wow, so we look for a very rich and thought-provoking discussion tonight. So on behalf of Penn Wharton Entrepreneurship, Lifelong Learning, and the Wharton Customer Analytics Initiative, please join me in welcoming Ethan Prater.
Thanks, Irina. Are we on here? Is it audible? We're going to talk, we've got about 15 minutes. It's sort of an amuse-bouche, I don't speak French, but for the actual main topic, or for the main content tonight, which is a panel discussion with folks who work in it very deeply in analytics. And in this case, Eric and team asked me to talk a little bit about an example at a company where I worked called Castlight Health here in town, just a few blocks, literally maybe actually a block away, where, thanks a lot, Rachel, where analytics actually was and is the product. And it wasn't just a product for enterprise users or practitioners to help run the business or inform the business better, but actually used by end users and consumers. And so how did we at that company actually take these analytics practices and apply it to a healthcare discipline, a very specific discipline, and result in this product? And how do we do that? So that's what we're going to talk about. It'll be about 10 minutes, 15 minutes, so not super long, and it will be whirlwind. So we might have time at the end for a question or two, and if we do, that'll be great. Just they asked to put it on the mics because they're taping things, and so it comes up on the mic. And if we don't, and if there's a burning question, you can ask it on the panel afterwards. So you go and have a service performed and actually consume that service, and then you don't find out what its cost is until days, months, weeks later, right? And if you ask somebody, even again in 2017, how much is this going to cost? That somebody is going to have a hard time telling you in that case. So that's the kind of macro level conditions under which we came up with the vision for this product. And so we're thinking a few what ifs. Is there a way to actually make healthcare better by introducing a price signal to the healthcare marketplace, in particular a consumer price signal? Would it take on the same effects as other markets do, when consumers know what they're paying and consumers actually can choose based on a price and quality signal? It seems in other markets that the price of goods tend to go down and the quality of goods tend to go up. And that's something that healthcare has not happened in healthcare in the United States in the past 70 years or so. So actually, we can maybe make a big impact on that market by introducing a price signal. So what if consumers could know the cost and quality of healthcare before they went? What could happen? What if the experience of actually looking for healthcare or consuming it felt something like other consumer services, and not just this kind of whole separate, opaque, scary thing? And would that actually have a good impact or a positive impact on the cost of healthcare in the US and the quality of healthcare in the US? So that's what we're thinking with that product. And so that the idea that with consumers at the center and consumers actually being able to incorporate the price and quality signals themselves into their healthcare choices, which doctor, which hospital, which lab, which pharmacy to go to, that it actually should save them money, save the system money, and raise the quality of healthcare in the United States. So that was our thinking. And so now I'll move a little bit to this primer on how healthcare prices are determined in the US. So we'll make it quick. And we can't resist quoting our first Penn grad and Wharton grad president in the title of the slide. And so nobody knew that healthcare could be so complicated. So 3 constituents in the healthcare ecosystem. These healthcare service providers, we'll call them providers. These are the folks who sell the services for in this context. There are about 6,000 hospitals in the United States, about 200,000 labs that perform, that look at samples and do lab tests, about 800,000 practicing physicians, and there are 25,000 or so billable services. So that starts to define the kind of data set that we're going to start performing analytics on here presently. These healthcare service providers negotiate with these middlemen that I'll call here health plan administrators. Sometimes people call them incorrectly, generally insurance companies or health plans or payers. So these are middleman companies that exist solely to negotiate and construct networks of healthcare providers on behalf of their customers, who we'll talk about in a second. So these are examples of these would be United Healthcare or Aetna or Anthem or your local Blue Cross Blue Shield. And there are about 200 or so, after those big ones, there are about 200 or so smaller ones that negotiate these networks. So these health plan administrators exist primarily to negotiate with providers on behalf of the third major constituent here, which is employers. So in the United States, employers pay for the health care of about just under half of the United States, people in the United States. Their health care is paid for by an employer. The other half of people who are covered are primarily covered by Medicare and Medicaid, and there's a small percentage, a growing percentage, that cover themselves through individual purchase. So these health plan administrators sit in between the employer and these healthcare providers. And so this health plan administrator will go to a hospital, for example, and say, hey, I'm going to bring you a big employer. I've got, the University of Pennsylvania, and the University of Pennsylvania has how many employees? 14,000? Yeah, I've got 14,000 employees and their families, and I'm going to bring you their business. What price will you give me? And then that health plan administrator goes back to the University of Pennsylvania and says, hey, I negotiated the best possible rate for you for your employees, and they do that, and that's their business, middleman business of negotiating those rates with all those employers, with all those doctors, all those physicians, all those hospitals and labs. And so one other element that's interesting as we get into the data is that the majority of employers in the US actually pay their healthcare bills, their employees' healthcare bills directly. So they are so-called self-insured. And in that case, that means that these employers don't just pay a premium to a health insurer who pays the insurance. These employers actually, when one of their employees goes to, say, a hospital, that hospital files a claim with this health plan administrator who says, yep, that looks right. So-and-so got a tonsillectomy. All right, employer, you need to pay $1,150 to that doctor. So these employers, in particular, there are about 2,500 self-insured employers in the US, covering about a third of our population. And they conservatively pay about $500 billion a year in claims. It's probably at this point closer to, with $3.8 trillion spent on healthcare in the US, is actually probably closer to $1 trillion now that the self-insured employers are paying. And so they actually pay all those bills. Trillions of healthcare bills are paid for by this set of employers and pay it directly, which is going to be important when we talk about the data. All right. Nobody knew it could be so complicated, but the goal is, what can we do if we could introduce that price signal? And how could we actually figure out what it is? What Dr. X charges for a tonsillectomy, or somebody, a lab in the hospital charges to do a hemoglobin A1C, or a local clinic charges to do an office visit for a child. Like, what if we knew that? And what if a consumer knew that before the consumer went? They could actually look and say, hey, maybe I want to go to a different place based on the price of that provider. Let's introduce that. So how do we figure out those prices? If we could bring that to those consumers, that'd be pretty cool. Well, these are knowable kinds of things. Like this master price list that we're trying to get to, these are negotiated, documented prices. We just get them and then start showing them to consumers, and then the healthcare system becomes better. That's the kind of idea. It sounds pretty easy. And so for example, the healthcare service providers, they know what their prices are, right? They know that they've negotiated, for example, with the local Blue Cross Blue Shield plan to charge a certain amount for a certain procedure. And they know that they've negotiated with another plan, say Aetna or some other carrier, to probably a different rate for the same procedure. And so they know those prices. And then these folks in the middle, these health plan administrators, they also know the prices, because their whole reason they exist is to negotiate those prices. And so Aetna knows exactly how much it costs for an Aetna member to go to a doctor and get a certain procedure done, for example. And so early on you think, well, maybe I could just go ask one or both of those constituents in this ecosystem to tell us what the prices are. And that way, the world will become transparent, and consumers will have power, and healthcare will get cheaper, and the quality will get better. But it turns out that those two constituents actually have a strong interest in consumers not knowing the prices. In particular, these health plans in the middle compete with each other based on how low they can negotiate prices with the same provider. So imagine out here, Sutter Health, for example, they negotiate a certain rate with Aetna, and they do an anti-transparency provision in there that says, hey, Aetna, you can't, or Aetna will tell Sutter, you can't tell United what you negotiated with us, and vice versa, because then United would know that what price Aetna would take. And so both of these constituents in this ecosystem have a strong incentive not to disclose the prices, and in fact have contractually agreed with each other not to let consumers or employers know what they charge. I find this maybe immoral, and it certainly is not helpful to introducing these presumably positive marketplace dynamics to the healthcare system. And so what we thought for our product, and here's where the analytics come in, what if we took the data that these bill payers have been paying, every little bill that they have paid for every one of their employees, and figured out what the health plan administrator told them it cost to go to a certain provider in a certain area, and essentially reverse engineered that master price list here that says, Dr. Smith, somebody went to Dr. Smith for an office visit, and the insurer or the payer says you need to pay $75, and we actually started building this master price list using the information that from these employers' bills or claims, and then showing that back to consumers so they could actually make a meaningful decision. So there comes the analytics. So how we started was finding a big self-insured employer, in our case, again, public information, it was Safeway. 40,000 employees in the United States. And you assume that generally about you multiply about 1.8, and that's how many people are on their health plan. So you've got about a data set of maybe 60,000 people or whatever, and a little more than that. And we have their healthcare claims, and we can actually start taking these big healthcare claims data sets, which has, for example, a member ID, and a bunch of information on it, and start figuring out from that what the negotiated rate was. So, for example, we see that somebody went to Dr. Smith for an office visit, and they're on a Blue Cross Blue Shield plan, and $75 was what our bill was, then we could maybe assume that Dr. Smith's rate on this master price list is $75. And so start taking these healthcare claims data sets and reverse engineering that into a big master price list. And super interesting results start coming out of that. Like, you'll find that Dr. Smith has much different rates with lots of different insurers. So the exact same service might be $50 with one insurer, but $500 with another insurer, big rates. And you might find that a doctor next door to another doctor on the same insurance or the same carrier, same network, would also have radically different rates for the same service. So lots of interesting things start coming when you can actually take that data or these individual claims and start assembling it into this kind of master list. And we did a prototype. The company at the time was called Ventana, and to try to prove, this is probably mid-2010, that this could actually be done. And I don't know if this example really shows, this example just shows a bunch of the lowest cost providers, but actually prove with one data set that you could take that information and reverse engineer and create this master price list of physicians or hospitals in an area using an employer's set of claims. Like any data set, there are big problems with it, and it is painful and difficult to use. And healthcare is probably, I don't know, everybody probably thinks their data set's the worst, but healthcare, I will claim, might be the worst. And so, there was a couple of benefits in that when we talk about sparse data, like when you get a claim, it doesn't have empty fields in it. Typically, that's a bill. It had a dollar amount. It had who do you pay. It had a date. It had a service in it. So there weren't actually very many cases where the data itself were, the records themselves were incomplete. But there were lots of cases where we didn't have a record for something we cared about, for example. There might be a big hospital in a certain region, and we would see that no employee from that company had actually visited that hospital in a reasonable time, so we couldn't actually figure out, the employer never paid a bill, so how do you actually figure out what that hospital's negotiated rate is? So in that case, the reality we were trying to reflect was coming from data that we didn't have, and it wasn't, and it was not just trying to fill in empty spaces in a record, which there are some great techniques for, but there's actually no record. And so interesting sparsity problem. You would think that in the largest sector of the US economy, now $3.8 trillion, that maybe that the most important part of a business potentially, or an important part of a business is getting paid, that this data would be reasonably kind of clean. But the actual quality of data exchange and even providers figuring out how much to bill, and then those payers or as health plan administrators figuring out how much to ask their employer customers to pay, not consistent. So a lot of messy data resulting from poor business practices or untidy business practices on the back end. So for example, same doctor, same service, same health plan, two different prices. Logically shouldn't exist, but we'd see it happen a lot in the data. And the biggest part, and this is actually probably one of the biggest lessons from, I think, any of these analytics things, and maybe we'll talk about on the panel here too, is that it's super powerful to apply some of these horizontal general analytics techniques to these data sets, but you have to kind of know the underlying reality, and in particular, your business. And in this case, these prices are constantly being renegotiated. So if we saw a price from a year ago, that actually may not be the price today. And so we have to kind of guess at this moving target from these old data to actually figure out these things. And so, so that underlying reality is very much was and is a moving target. So hard problems there. And we applied a bunch of what I would call standard, or the kind of techniques that we teach in business analytics to figure out some of the stuff on the back end. For example, if you start figuring out that a certain provider is generally more expensive or is always a certain percentage different from another provider in the same region, you could start filling in holes there and assume maybe they were negotiating off a relative discount. Or if you see one physician at an address who performs a service and another physician at the same address performing a service, you maybe start to assume that they're in the same clinic and they're using on the same contracted rates. So there were techniques and are techniques that you can use to actually fill this data in and make it better and get to that master price list in a better way. And and of course we do that. And then to the change point, we were talking about knowing again your business. When do these things tend to change? Most providers start their new rates on January 1st. So we can assume if we that between January 1st and December 31st, things will be relatively stable, and start putting some of those assumptions into the analytics and that reverse engineering. But the cool part, or one of the cool parts, I think all of this is cool, but one of the cool parts, I thought we talked about this a lot. So research shows in a household with an adult female that she or they will make the predominantly make the healthcare decisions. So in something like 90% of households that this was the case. And so when we think about how to actually present this information back to a consumer so that she, quite literally, or in 9 out of 10 cases, can make a decision, that's how we start thinking about that use case and how to actually take the product of these complex, dirty analytics and make it actionable to a consumer. Like we don't want to teach a consumer all these things about who pays what and that there are providers and CPT codes and all. Like you don't show that. It is really, my daughter's sick. Where's the best place to take her? And so those are the kinds of questions, and those are the kind of impact of presenting this analytics back to people, to real people, so that they can, real consumers, so they can make decisions. And so the biggest kind of issue there is when the product promise is to give an e-commerce-like shopping experience to a consumer, how do you indicate uncertainty? And consumers aren't used necessarily to seeing uncertainty on a Expedia or Hipmunk listing. This might cost you $250, but we're not really sure because our data is a little bit older. Or you can go this other place, but we don't know how much it's going to cost. Like that starts to really kind of cause trouble with product trust and actually and helping people make meaningful decisions. So the actual presentation of this analytics output in a way back to consumers meets their expectations and is still useful but not misleading is probably the most interesting and biggest product challenge that we faced and that they still face there. So. And the first, again, more than 9 times out of 10, the first thing somebody would do when they use our product, look up their own doctor. And all right, and then figure out, is my doctor more expensive, less expensive, better quality, lower quality? And if if other people, if we didn't have a record for that physician, we lost that consumer because she wouldn't use the product again. So how do you do it? How do you show uncertainty? And so we've experimented and used a bunch of different ways. Do we show a range? We think that this office visit's going to cost you between $75 and $125. You could do that, but when a lot of ranges start overlapping, it makes it hard for you to actually decide based on that price signal, like, if everybody overlaps, like, it could just come in the middle of this and I could go anywhere, and then it actually isn't helping you make a meaningful decision. Or do we show an anchor price and then start trying to show relative, say it's a hospital. Hospitals typically much more expensive than standalone clinics. Start showing us, we know this hospital's super expensive. So, like typical price is this person's $4 signs or $5 signs, or this hospital is, a great one or a high efficiency hospital, and it might be $1 sign with some. So how to actually represent uncertainty in this kind of analytics to the consumer was a big challenge, and and I wouldn't say that it was we've ever, or at least I ever really solved it, but tried and experimented with a bunch of different techniques to present that analytic uncertainty to them, and so and the freshness was another one too, like we laughed about it earlier, but pretty sure that this was the price a year ago, may not be the price today. Like this is, you've lost a consumer when you start getting there. And so how to indicate freshness in an easy or an easily consumable way that still gives them powerful information. Interesting problem and interesting question in product design there. So And so, over time and over those 4 years, we made some good progress. As I mentioned, hundreds of thousands of people using the product a few years ago, and now several million, and also got some great data sets. For example, one customer, Walmart, second largest purchaser of healthcare in the United States after the U.S. government. 1.3 million employees and their dependents. So Walmart's, one of their biggest businesses is buying healthcare for their employees. And talk about a great healthcare data set to work from. And so super kind of powerful and exciting things there, but that consumer problem, again, one that we really had to have to address in presentation. So the takeaways, this product category, which became an enterprise software category called healthcare transparency at the time, and price transparency, its product is analytics. And so that was kind of an interesting thing to work on. And but the other piece of it was, this was also a consumable analytics output. And so how to make that work from this messy data was also an interesting challenge, especially when there's this complex healthcare system behind it. And probably the biggest lesson, we work with lots of data scientists and others who would apply general techniques, but knowing your business and your industry and your vertical was probably one of the most powerful things we can apply on top of this messiness, that contracts change on a certain time, or that doctors tend to do things in a certain way, or that hospitals negotiate relative to each other. So once you could get a sort of a bead on their relative prices for some, you could get on others. So knowing those industry-specific, vertical-specific facts really made a lot of the analytics techniques we applied, I think, be more powerful to the end user, to our buyer, who is the large enterprise. So that's what I've got, and I think I'm right on time here. So we won't have time for questions. This is me if you need to track me down. These are some of the companies that I work with now. Currently, some in healthcare, several are Wharton entrepreneurs, and some in advertising technology. All of them, I think, analytics heavy, except maybe one or two on there. So, so grateful for the time, and again, if there are questions, you can address it to the panel. We don't have time now, so we can do it to the panel.
So maybe if our panelists could come up, that would be great. So Irina already introduced me, but let me introduce myself. My name's Eric Bradlow. It's hard for me to believe, but I've been a faculty member at Wharton now for 21 years. I'm the founder and the faculty director of the Wharton Customer Analytics Initiative. We're really thrilled and honored to be partnering with Penn Wharton Entrepreneurship for the Scale School event. The Wharton Customer Analytics Initiative, which is the center I direct, has been around for 9 years. And you might wonder, well, you have analytics at Wharton, we have entrepreneurship at Wharton, why haven't the two met? And actually I can give you a very simple reason for that. I'm not sure I know that much about what analytics for startups should do. And that's why we're kind of having the panel today. When we started the center 9 years ago, analytics was the thing big businesses did. It's what, we have a Google panelist today, Krista here, it's what Google did, it's what Facebook did, it's what large companies have done. But now, 9 years later, everybody, whether you're a $1 million business or a $1 billion business, has to understand analytics. And I love moderating panels because just like you, I don't know what the panelists are going to say either. And so this is an opportunity for me to learn and learn along with you. So the way the panel is going to work is I'm going to introduce each of our panelists. Obviously, I don't need to introduce Ethan, given Irina just introduced him, but I will introduce Jessica and Kristen. Then I will ask each of them to make an opening statement, if you'd like what does scaling with analytics, which is the name of the event, mean to you? I'll ask them a couple of questions, and then if these types of events are anything, it'll be Professor Bradlow, shut up. We want to ask the questions, so Professor Bradlow will shut up except for moderating your questions, and I'll move the questions on to you. So let me just grab a seat here and we'll get started. So sitting to my immediate left right here is Jessica Lachs, a very proud Wharton alum, Wharton grad 11. Jessica is the head of operations and analytics for DoorDash. And so for those of you, I guess I'm very familiar with DoorDash as well as its competitors. It's an interesting business model. She's the head of business operations and analytics. I love the way this is written. Jessica and her team are responsible for all things data at the company. Let me just say, by the way, that's one of the coolest things someone could say about their job. I really like that. Prior to her current position, she was a general manager at DoorDash, where she helped launch new products. Prior to that, Jessica founded GiveSimple, a social gifting startup. And before her entrepreneurial endeavors, this is not uncommon for Wharton people, Jessica began her career in investment banking, spending 3 years at Lehman Brothers in New York City. Jessica holds a BS from Cornell, and of course, as I mentioned, an MBA from the Wharton School, and she currently resides in San Francisco. Let's welcome Jessica Lachs to our panel. And Ethan Prater, of course, is sitting to Jessica's left. And I will just say one thing, both Ethan and his wife Anjali are here. Besides them both being students of ours, Wharton Grad 04, they're both on the executive board of the Wharton Customer Analytics Initiative. They've both tirelessly work to help Wharton build its brand in analytics. And for all of us Wharton alums, it's myself as well a Wharton alum. Besides a faculty member, I'm also a Wharton alum. It's great that we have two such ambassadors. So let's welcome Ethan here as well. And last but not least is someone that is a Wharton alum, but of a different type. 9 years ago, it's hard for me to believe it's been 9 years, I'm the founding director also of the Google Wharton Marketing Academy. So for 2 weeks every year, Google sends 75 Googlers to our Philadelphia campus to learn everything about marketing and analytics, and I founded that program along with Lorraine Tuhill, who's, I think her exact title is probably Senior VP of Marketing maybe, at Google as well. Krista was in maybe our first class? No. Second class? Third class? Somewhere in there. I think. So one of the early classes at Wharton. Her current title is Analytics Advocate at Google. She's an experienced leader in the digital analytics industry and obviously a frequent speaker. She's driven analytics and optimization in places like Adobe, the Apollo Group, and of course most recently Google. She's actually a very active member of the digital analytics community here in San Francisco. She co-chairs the San Francisco chapter of the DAA, the Digital Analytics Association. She's won many recent awards from the DAA. She holds a BA in Economics and Political Science from UC Berkeley. And as I mentioned, she's also one of our proud alums of the Google Wharton Marketing Academy. So let's welcome Krista Seiden. So without further ado, maybe I'll start with Jessica. All three of you agreed to come to speak to an event, Scaling with Analytics. The way I describe it is anybody, I joke when I say this to people, like when people say, so what are you doing out here? I said, well, anybody can build $1 million business. Let's get that business from $1 million to $100 million. So that's my naive description of what scaling with analytics means. But forget about what I say. What does it mean to you?
Well, I think you're selling yourself short. I think we should be striving for $1 billion business, maybe even a $10 billion business. To me, when I joined DoorDash back in summer of 2014, we were only in Silicon Valley and we didn't have an analytics function. And I think that as you grow and as you make mistakes and see successes, you want to understand the why behind why you're making those mistakes and why you're seeing those successes. And I think that is really what sort of fuels the need for analytics, is to be able to answer questions. And I think that as you grow, your questions get more complicated. Sometimes they actually don't get more complicated, but they get more complicated and the data that you're collecting gets bigger and also more complicated. And you need to come up with a way to answer those questions and to grow your business. And I think for me, scaling a business is, or at least analytics as it relates to scaling a business, is really just about being able to be smart and make better decisions and to give yourself the tools that you need to make those decisions.
It wouldn't be a bad takeaway for all of us from Jessica's last comment to say, only do analytics if you want to be able to answer business questions. It's not a bad takeaway. So Ethan, what does scaling with analytics mean to you?
I work at an accelerator, mostly here in San Francisco, and it's B2B companies. We have 3 cohorts of 20 companies a year go through. And all of these companies are eager to get from 0 to $1 million to $1 billion as quickly as possible. It's a venture-backed accelerator. And it's nice to see now that it's not a question of if on analytics, like it might have been if we were sitting here 6 years ago or something like that. And if anything, an answer that maybe holds them back a little bit from scaling is when, and sometimes it's even a little too early. Where in some of these businesses, where when they try to adapt an analytics practice and draw conclusions from a paucity of data, for example, and so so I'm really interested in that. I think we're most probably preaching to the choir here, but where analytics make business decisions important, building it into your business from day one, super important and required. But when to draw what kinds of decisions from that analytics has, I think, a big impact on the rate at which you scale.
Yeah, one of the things we're going to spend a lot of time talking about this evening is when is the right time to, if you'd like, invest in data science? Like, should it be your third employee? Should it be your 30th employee? That's going to be a big issue that lots of small businesses talk about. And Krista, obviously Krista, as I mentioned, worked for Google. For those people that don't know, Google once was a small company and obviously scaled, you could argue scaled a lot with analytics, but of course Google's one of the leading provider of services to SMBs, small and medium-sized businesses. So it would be great to get your perspective on scaling with analytics.
Yeah, definitely. So I have worked across many size businesses in my career. I've done a lot of consulting with small businesses, especially in my role at Google. I meet with all kinds of businesses. I think it's really interesting, though, in terms of this $1 million, billion topic that we have throwing on here, because at Google, if you have $1 million business, nobody cares. If you don't have that next $1 billion idea, you're not going to get your idea off the ground. And I do really believe that that is rooted very strongly in data. To be able to get any kind of support for an idea at Google and to grow internally, you have to show that data that you have. And that means that you're not only collecting it early on, but you're also looking at what else is out there in the market and how your product might fit, and data plays into all of that. In terms of when to get started with data, I think this is a really interesting question. I'm looking forward to talking about it more, because I do think that you should start at a very early stage, and that it does scale all the way up through these large businesses and becomes ever more important the larger you grow.
Well, one of the things, by the way, I've always decided when I moderate a panel is, because I've sat on panels and I've moderated them, I hate being the last person being asked the same question. So what I'm not going to do is ask each panelist the same question each time. I thought I would just start with that one. But now I'm going to start targeting questions to each of our panelists, because I think that's a more efficient way to go. So Jessica, let me start with you. One of the topics that I'm sure a lot of people in our audience are wondering about is what we call the rent-buy decision, which is, when do I hire the Wharton Customer Analytics Initiative to work with us, or when do I hire a firm that specializes in analytics, or when do I bring those skills in-house? So what thoughts do you have, and any examples you could give with DoorDash would be great. How you guys think about it would be wonderful.
Yeah, so I think when we think about renting versus buying, typically we think about software tools. But I do think that if you have a sort of discrete project that requires a certain set of skills, and you can hire someone, whether it's the Wharton Customer Analytics Initiative, did I get that right?
Yes, you did.
Or it's interns, or it's consulting firm. Sometimes that does have a need instead of bringing someone in-house, especially early on. But I think that for DoorDash, when you're just getting started with data, a lot of the time there's a lot of really great third-party software tools and packages that you can use that provide a really kind of great off-the-shelf solution that'll sustain you for a good amount of time. And I think there are some third-party tools that we still use even at our current size, and then there are certain things that we've built in-house. So for example, we use, there are a lot of dashboarding tools to make really pretty dashboards and visualizations, and we've used a couple of them. Tableau is, a lot of people know Tableau, people know Looker, Chartio, Periscope, Mode, I could go on and on. And we've used those because they create really easy to understand dashboards that you can use to power discussion and kind of track your metrics and monitor your progress. But when it comes to something like experimentation, for example, we started off using some of these third-party providers and realized very quickly that our business was a lot more complicated than what these tools are built for. And so if you're running an experiment looking at whether a button should be red or green, that's sort of the common example that's used, a third-party solution might work really well. But when you have a logged out and a logged in experience, which DoorDash has, you can browse our restaurants, you can get all the way to the checkout without ever creating an account or logging in. We need to be able to track who you are and what you're doing and how you're interacting with our product logged out, and then map that to what you do as a logged in user and be able to run experiments where you see a consistent experience. Or we know that you didn't see a consistent experience and we can take you out of the data set and not use your conversion or lack thereof as signal. And I think that was something that a third-party provider couldn't do for us and that we needed to build ourselves. And so I think a lot of the time, just getting yourself started when you're small, renting's great, right? It can get you 80% of the way there, and that's what we all try and do, right? Get 80% of the way there as quickly as possible and start getting the insights and getting the answers so we can move along. And then ultimately that will start to fall short, and that's when you really need to invest and build from the ground up, whether it's software or an entire team.
So Ethan, let me ask you a question. So obviously you were telling us in the last 25 minutes or so about Castlight Health and how you guys, in some sense, analytics was your business. It was so fundamental to your business model. To the 100+ people in the audience here, who should be thinking about adopting analytics early in the path? Obviously, if it's your fundamental business, well, it's your business. But what checklist should our audience be listening to and saying, yeah, you know what, we really need to invest in data science?
Well, maybe I'll try to tee this up for Krista. I know you don't. Oh, we were not going to go that direction. Ask the same question to all three, but I think it is driven by the business. It should be driven by the business as opposed to maybe the technical side of things. On the one hand, it really takes sort of a manager or practitioner or business leader to be like, I really want to know this thing. If I knew this thing, I could make a better decision, or we could do things better, and just asking that question and asking that's, I think, the driver for getting there. But starting a business, it's really painful to have that person ask a question a year out and not have any of that data available. And so if you can actually configure the business early on and be a kind of smart technical leader and start having that data available, even if nobody's using it, then it could be a really powerful thing when a year or some period from now when the business starts asking for that question. So I'd say kind of on the business side, it's going to be driven kind of organically by some business leader who wants to know, and maybe that's somebody in this room. But on the technical side, you can be ahead of that and actually kind of make that data available and be like, oh, hey, yeah, here it is, as opposed to okay, we'll start collecting that now, and a year from now we'll be able to give you that answer. I think is kind of how I'd say about on the when and the who.
Yeah, so notice Ethan's differentiator. In some sense, he's suggesting that all startups should start by at least collecting the data. Whether you're going to be using it tomorrow or have a data scientist, I'm sure I see everybody nodding their heads on the panel. My guess is every company I've worked with that didn't have a data mindset and 5 years down the road, let's just start collecting stuff. It rarely goes well. If that mindset isn't there to begin with, it's hard to turn from a non-data to a data-oriented company. So Krista, one of the things that relates partly to Jessica's point that she asked about was she used the magic word experimentation. So lots of firms here should be thinking about what I call an experimentation, optimization, or what lots of people call test and learn mindset today. What advice or thoughts would you give to the people here about kind of an optimization, experimentation, test and learn mindset? And also maybe what's Google doing in this space?
Totally. So optimization and personalization is actually one of my favorite topics. I talk a lot about this. I blog a lot about this. I think that it's something that businesses of all size really can do. And I think it's an interesting point that's been brought up a few times in terms of when is the right time to start doing it, to really push those levers, because maybe you don't have enough data or you don't have the right business goals at the time, but it's something you should keep in mind. And I think to keep it in mind, you first have to start with the data. I've been at a lot of events recently, actually, that specialize in CRO, conversion rate optimization. And it blows my mind every single time that there are entire businesses and companies built around CRO that don't actually start with the analytics data. Because in my mind, I think that's core to anything that you do. You start with an analysis of what's going right, what's going wrong, what is not converting as much as it should, or where your high-value pages or your high-value products or events that you want to optimize, and then you go from there. So some of the things that Google's doing specifically are, we actually released recently out of beta, Google Optimize. If you've heard of this, it's our A/B testing, multivariate testing platform. It's similar to like an Optimizely or a VWO. It's got a nice visual interface that you can drag and drop and click to edit and make changes very quickly. But the differentiator actually is that it's linked with Google Analytics. It's built on the same platform. And so the data that you're optimizing against is the same data that you're collecting on your website and have already designated as your business goals.
What took so long for that to happen?
I know, right? It's the same data set. So it's really important because you're optimizing against the data you're already collecting and looking at. And I think it's a really wonderful tool. And the best part about it is that there's a free version, and so if you have a website or if you have a friend who has a business, anybody can go ahead and try this out and just get your feet wet learning about optimization and start to understand what that A/B testing process might be like.
Yeah, so one of the things that Krista brings up that I think is crucially important is that, one of my favorite quotes, one of my senior colleagues, Jerry Wind, says, only run experiments if you want to know the answer. If you don't want to know the answer, don't run an experiment and just do a bunch of fancy math. Jessica, let me ask you a follow-up question related. So can you give us an example of maybe both a situation where you have used, at DoorDash, have used analytics, or maybe even one where you've kind of ignored it, where the data may have said X, but you say to yourself, maybe it's also related to Ethan's comment is, of course, you ask a computer to come out with an X, it's going to give you an X, but maybe the margin of error is so large around it, or you're not certain yet. So what would be an example of a business problem that you've used to help, that analytics has helped solve a problem?
Yeah, I mean, I think, so there's sort of two parts to that question, and I think that, as much as we talk about the value of data, there are decisions that you want to make that maybe aren't backed by data or where the data doesn't support that decision. Things like, the way that a belief that your company has, or a way that you want to position your company because that is sort of your vision for the company. A lot of the time that's not backed by data. A lot of the time that's set out really early when there isn't even data to back it up. And I think that those are perfectly valid decisions to make, so long as you know that you are doing this because it is something that you fundamentally believe, and that you want to make a decision that maybe you could have made more money if you did it a different way, but you believe that this is the right way to do it, and so that's great. I think for us, one of the kind of fun stories for how I experienced analytics helping us early on was in the early days of DoorDash, when we launched Boston, we would run pricing experiments that were not set up in a great way. I now know better. At the time, I did not. And we would make changes to price. We would either lower price or increase price, and say, okay, well, if we lower price by $2, the delivery fee that we're charging, we're going to see an increase in volume. And so we would lower price, and we'd see an increase in volume, and we'd be like, it worked. And then we realized, well, it also rained. So it rained, and a lot of people ordered delivery, and so volume went up. Well, how much of the increase was because of the rain, and how much of the increase was because of the decrease in price? And it sounds silly, but a lot of people, this is sort of like a very simple example of the complexities of running experiments, right? And so that is why the value of A/B tests take out some of the the external noise from the experiment that you're running, so that you can better isolate the change in the variable that you care about. And so pretty quickly we realized that this was a terrible way to run experiments. We were not getting the insights we needed. We had no idea what the impact of increasing or decreasing by $1 was on volume. And those were the kinds of questions that we wanted to answer. And so we started implementing much more rigorous A/B tests, and obviously have a much more complex understanding of the elasticity of demand. So I think that was one of my kind of favorite stories from the early days of DoorDash, and the mistakes that you make and you learn and you get better every day, and that's what we all try and do.
I don't think that sounds funny. I think it sounds like a fundamental business question to DoorDash. What's the price elasticity of demand for, let's say, delivery fees? I mean, to me, that seems like a fundamental question that you would want to know the answer to. And if without analytics, and measurement and experiments, then I don't know how you answer that question. I mean, you have,
You can ask a lot of customers, and they'll tell you that they want delivery to be free. So that's your other option.
So Ethan, let me ask you a question. So many people here may also be working for more established, larger businesses, and they're also thinking about, so maybe we didn't start analytics at the beginning. Any advice you would have? Like, how do you kind of infect your business with analytics? How do you get started with analytics? Because a lot of people here are saying, wow, there's lots of terms out there. There's cloud computing, and then there's artificial intelligence and machine learning, and there's analytics and algorithms. And how do people even get started to get a handle on this?
I think to someone's point earlier, it's almost a cultural thing, and it's never too late. And that sense of introducing analytics or at least data into meetings and conversations has a powerful effect on the culture. So if it didn't exist there before and you think it's useful, like just put some data in in your business case or in your slides or in your way of talking. And so again, it certainly happens great when it starts from the top. And I worked at a large company, large private equity-backed company. And we got a new CEO, and it was a healthcare network company processing trillions of claims and payments transactions every year. And he said, new CEO started, he's like, I don't want to have any conversation that doesn't have data. And again, data and analytics may be separate, but and so introduced it in the culture, like radical change right there. But also seen it in these large companies where a practitioner maybe starts just using it, and then so he's like, wow, that's really powerful. And then and so that sense of like, hey, this person's doing it, it's really powerful. I think gets picked up. So I think it's culturally, and I think it can be introduced probably by anyone.
So I'm going to ask Krista one more question, and that's the cue for audience, start thinking of your questions, because Bradlow's shutting up and I'll just start pointing at people for questions. So Krista, let me ask you one last question here. One of the things I would think about is that a lot of people will say surveys. I came out of the primary marketing research and survey world. I spent 5 years at DuPont in their business intelligence division. Surveys are dead. Like, why do I need to ask people stuff when I got transaction data? So what role do you see that surveys or focus groups or even just observational data still plays in the role of big data and analytics?
Yep, I think that's a really fundamental concept here, actually. I think the data, the hard data, the quantitative data can tell you the what of what people are doing, but it doesn't actually tell you the how or the why. And I think that's where the survey data comes into play. I've ran an internal analytics or an optimization program at Google for a few years before my current role, and we did a lot of website testing, and we built up over 2 years to this giant website redesign that we had tested our way to. And when it came time to launch this redesign, of course we tested it, thankfully, and it didn't perform as well as our marketing team had hoped. They put all of their time and effort into this new website redesign, and it was not even flat. It was a few percentage points worse off in terms of their key performance indicators. But one of the things that I did with this test was on both the control and the variant, we launched a survey simultaneously, and we collected qualitative data asking people basically what they thought of this new website experience. And we didn't frame it as a new website experience. We asked them fundamental questions, like, are you able to find what you're looking for? How satisfied were you with this experience? How easy was it for you to find the information you're looking for? Are you ready to take the next step forward? And so after a few tweaks to the new website based on some of the data that we had seen from the test, along with the qualitative data that we collected, we actually were able to make the case that this new website was actually better off because people were overwhelmingly happier with this new website. They had a better experience, were able to find what they were looking for much more, and we wouldn't have had that push to the finish line without that qualitative data. So I can't stress enough how important I think qualitative data is, not only in the testing process, but also in the product design process, and that iterative approach to building products, really, really important and shouldn't be discounted when it comes to the types of data you want to look at.
Thank you. So this is the time where I'll turn it over to the audience. I believe there are microphones going around, and maybe Rachel, right next to you. It would be nice, by the way, if you introduced yourself when you asked the question, and also if it's for Jessica, Ethan, or Krista, please say specifically, and if not, I'll just see which panelists raise their hand to answer the question first. So please, go ahead.
Hi, my name's Nathan Grossman. I'm a former Wharton alum as well. So my question is specifically for Ethan, and I think what you've done is very impressive because it seems like you've built a machine to kind of determine or estimate the prices for transactions where there really isn't a lot of transparency and there's a lot of missing data. And I just wonder if, being that you're an accelerator, you thought, are there other business models to which you could apply the techniques you've developed or maybe even some of the infrastructure? So for example, I can imagine an investment fund that would try to find arbitrage opportunities for goods for which there isn't a lot of price transparency. Or, for example, a business that held itself out as a negotiator on behalf of consumers, where the consumers might not have the ability to gather all the data or even want to do the negotiating, but as an intermediary, you would have that data and that ability to find the best price for the customer.
This is, I think, a fascinating question that I'm embarrassed that I don't have a good answer to. This idea of a knowable truth from a set of data that introduces a whole new business or category in a similar way. Certainly opaque markets seem to be the place to go there, but I don't know. Does anybody else up here have some ideas where we could apply that?
The only one that comes to mind, I don't know, Nathan, if this is what you had in mind, would be kind of like deal sites where you place a bid in and they all of a sudden say, we're going to negotiate some price on your behalf. It is an interesting thing, though, that, Ethan, to your credit, in some sense, what most people do in business is develop a skill set and then it's a hammer, and then hammer it on different problems. I've never thought about that question either. It's a good one. I don't know, maybe you have some suggestions.
Well, just another example that comes to mind. Let's say you're trying to get contract manufacturing done in Asia, and probably you have very sparse data as to really what price different factories are offering, or to transport goods. And if you could, using your beautiful machine, kind of connect the dots and fill in all that blanks, you might have a big advantage when negotiating with suppliers, et cetera. That's like the kind of thing just off the top of my head.
Okay, we'll take now a question maybe from this side. We're going to do kind of left, middle, center kind of thing. Questions from over here? Oh, there's got to be questions. I got a ton of questions. You got to have some questions. Please, right here in the back. Gentleman right here in the back.
All right. I'm Pat McBurdy. I'm a Wharton grad, and I work at a company that works in the customer experience sector. So we collect a lot of that structured, unstructured data from customers. So I'm kind of digging in on your previous question, but I'm wondering, have any of you looked at sort of the predictive power of combining both kind of that hard data, the operational data, and structured, unstructured data from the customer to kind of get more predictive? I mean, my hypothesis would be that it's far more predictive than either would be alone, but I'm not really seeing that really in the market, and there's so many subscription businesses out there, both consumer and B2B, and I don't really see it being employed, and so I'm wondering if you've looked at that problem at all.
Yeah, so Krista, why don't you take it, and maybe Jessica as well. I don't know if DoorDash collects reviews or comments from customers. It'd be interesting to hear what you do as well with the unstructured data, but why don't we start with Krista?
Yeah, I think that's an awesome question and an awesome thing to investigate. It's difficult because, to your point, a lot of that qualitative data is unstructured. So things like a thumbs up or thumbs down or a star rating or something like that in terms of customer satisfaction, that's really easy to build into those type of predictive models. But when it comes to parsing out somebody's words, such as sentiment analysis, well, somebody could write a sarcastic sentence that might be taken as positive, but is actually negative. And it's really hard to understand if that is a good indicator of what you really want there. And so, have we looked at it? Of course. We're looking at a lot of areas where we can use machine learning, AI, and predictive. I don't have a good answer for you in terms of parsing out a lot of that unstructured data. I think we're really looking at getting as much structured data as possible, and possibly turning some of that unstructured data into a more structured data set by guiding the types of qualitative answers or questions that we're asking.
Yeah, just before I ask Jessica for thoughts as well, maybe on DoorDash, just to let you know, everybody that takes textual data which is unstructured, turns it into structured data. If you want to think about it, they're adding quantitative variables to their models from that unstructured data, and that's the magic. The magic is how are you actually going to take language written in, words in the language of the human, and parse out the stop words and get everything together and put it into quantitative variables. That's the big challenge. But Jessica, maybe some thoughts about what you guys do at all at DoorDash.
Yeah, so I have a very sort of similar answer, and we've built some models, some natural language processing to try and derive sentiment from the feedback and text, especially on our customer support organization. So interactions with customers when something has gone wrong or when they have a question, and trying to take that information and turn it into a feature we can use in our predictive models with varying degrees of success. I think it's something that we're actively working on, because I do think that the information you get from qualitative feedback can be incredibly valuable. I think we have a tendency to assume that people act rationally, and what you learn when you actually look at the qualitative data is that people are irrational, and the things that something that you put out that is better for your customer, they may not realize that it's better for them at this moment, or they may just not like the change that you made. And so it is actually a better change. It makes it easier or faster, or gives them more options, but it's different, and the reaction isn't what you would necessarily predict. And that kind of context, you really can only get that when you actually start talking to your customers one-on-one, and getting that kind of qualitative feedback. So it's incredibly valuable, and I think it's definitely an area of opportunity for a lot of businesses to be able to combine that with the more structured data that I think we've gotten further along at least using to our advantage.
I think as many people in this room who may know more about this than I do, but academics consider actually textual data kind of old school. Like those methods have been around for a while. Of course, as everybody knows, what's actually being posted now is more pictures. So now how do you do automatic processing of pictures? And of course, I'm sitting here with a company that owns YouTube. How do you do processing as well of video? And so now people are creating automatic analyses of pictures and actually a video. So forget text, our computer scientists will say that's easy to do. Wait till you get to pictures and video, which is now, more space combined than text alone. So I think there's a long way to go. Yeah, please.
Hi, my name is Daniel Ling. I work at a startup called Cherish, which is less than 50 people, and right now we're in the process of building out an analytics team. Who would you recommend are your first few hires, whether that's the mindset or technical skills or work experience? Curious to know who those first few people should be the foundational building blocks. And the second question too, kind of related, is is there a distinction between analytics versus data science?
So Ethan, why don't I start with you could take either question, but why don't we start with you about, how does one build an analytics group or organization, since you were a very early person at Castlight Health?
Yeah, this is kind of a hot button for me personally, and I'll be fascinated to hear the other panelists' view. Kind of like data scientist as a title and as a buzzword to me has become kind of meaningful, certainly as a signal in who to hire, and so, or a job to post even necessarily. It's so the definition is broad, and and anybody who did NLP, in the 50s now is a data scientist or whatever, and so it's just kind of, it's one of my soapboxes is, like a lot of these early stage companies, like, oh, I need a data scientist. And I'm like, what is that? Like, what data do you have, and what science are they going to be doing? And I think you look for characteristics of, like, a lot of folks who are kind of our data people will want to work with data, and there is a kind of meaningful distinction between setting up the infrastructure to collect it, and it's a certain kind of mindset and a certain kind of person who wants to do that and build that. And a year from now or 2 years from now, we're going to have all this data, so how do we collect it? How do we start structuring it? And look for that early, as opposed to necessarily like, hey, well, this person did data science at, whatever, PG&E, where they looked at, and like where they had some massive data set. And so I kind of look for those characteristics maybe in the early, late, and as opposed to necessarily advertising it with the title.
Krista, your thoughts?
Yeah, so I have a few thoughts here in terms of, I think this kind of answers both questions. I spent probably close to 4 months last year working in Asia, and one of the things that I noticed, or one of the things I was tasked with while I was there, was understanding the idea of data transformation in Asia and how our teams could really reach a lot more companies there. And what I noticed when I started talking to a lot of companies was that the idea of a digital analyst didn't exist in a lot of these places. They had pure marketers and they had engineers and data scientists, or people who were digging into the data in a much deeper way. Big data, they were using a lot of different programming languages, but they were missing that middle ground of digital analyst. And when I think about the European market, they have that middle ground, but that's something that they've come to a little later on. Whereas here in the US, I think we developed this middle ground of digital analysis and digital analytics much earlier in the cycle, and you're starting to see more people now go deeper with R and various tools on the data science side. And I think it's very interesting because I have a friend who lives in Sydney, and she recently has gotten into the analytics field. And when I talk to her about what she's learning, how she's getting into it, she doesn't talk to me about Google Analytics or Adobe Analytics or any of these analytics platforms that we know. She talks to me about learning R and doing this and doing that, and I'm just like, that's not how I learned digital analytics. So I think it's a really interesting question, and basically my answer is that I think these fields in a lot of ways are coming together, or the lines are being blurred. And who I would hire these days, I think, may depend on the market you're in. I still feel strongly that there's a very important use case of that middle ground of digital analytics and really understanding the user behavior, because I don't think that the data science part of it focuses on that user behavior as much. And so somebody who's inquisitive and who is willing to ask the hard questions and keep digging in that data until they find the answers they're looking for, as well as being a storyteller to be able to take those insights and synthesize them back to the business, is a really important hire. But in terms of the distinction, I think it's becoming less and less clear as we go along.
Yeah, just also to answer your question, INFORMS, which stands for the Society for Operations Research and Marketing Research, actually defines 4 basic roles, and Ethan kind of described it. One is kind of the first part is someone to set up your data warehouse. So that's one set of skills. Then there's someone like myself, someone that builds predictive models. Then there's, as Krista mentioned earlier, there's the person that does kind of the optimization stuff. So this is the person that has OR stuff. And then, of course, there's the person that derives business intelligence from it. It would be wonderful to think that you can hire people with all 4 of those skills, but it's really hard to find people with all 4 of that set of skills. And so that's the way we think about it, which is there's the person that's doing, SQL, setting up a Hadoop cluster, et cetera. Then there's the person that's doing the R and Python programming. And then there's the person layering on top the optimization piece. And then there's the person like, okay, now that we've built this data structure and everything else, now we've got to actually implement this inside the business. So those are the 4 basic roles that most people think about today. And you kind of need people with all of them.
Like the Starbucks Frappuccino, a little more elusive and doesn't necessarily taste as good as unicorns, right?
That's true. That is true. Maybe somebody over here on the left. See, I knew once you started asking questions, the hands would go up.
Hey, my name is Jackie Yin. I'm the analytics manager at Munchery, another food delivery startup. And you guys mentioned how to do pricing elasticity test incorrectly. How would you say the correct way to do a pricing test is? I've heard that A/B tests with pricing are like borderline illegal whenever I looked at them online. So I would love to get your input on this.
So Jessica, maybe you could start us off by talking at least. So what have you guys done at DoorDash since then, whether it's for pricing or something else? Like what do you consider a successful, let's call it, protocol for running an A/B test or an experiment?
Yeah, so I think that first you have to understand how you fit within the sort of competitive landscape, right? So I think this is very relevant kind of given your background and my background. And I think, understanding what a customer's willingness to pay is, as well as kind of what the other offerings are out there. I think that that's sort of one of the things that you want to start with, is just kind of understanding your position compared to others, as well as your offering compared to others. But when you talk about running tests, a lot of the tests that we do are on promotions, discounting, and how those offerings change behavior, right? How do they change upfront conversion, just for, someone who comes to the site is browsing the site or on the app, and how many of them actually check out, right? So there's just your basic conversion metric. But also, how does it impact a customer's order frequency? How does it impact their long-term retention? You may have a customer who, is, really hungry, really excited about that they're, about what they put in their basket. They get to checkout. They're unhappy with the price, but they convert anyway because you've gotten them pretty far down the funnel, and they're just really hungry. They want this food, so they're going to convert. But that signal can get or can be misread because they're not going to come back. They're going to say that was way too expensive, or maybe I can only afford to do this once a week. Whereas obviously we want people to order more frequently, and so I think understanding and tracking customers' behavior over a longer amount of time can really kind of help you understand the impact that price has on customer behavior, more so than just the short term, which we decreased price or we sent out a promotion for free delivery and volume went up. I think that tends to be pretty short-sighted, and I think you actually have to understand the sort of longer term impact, as well as as you run these promotions, you start to train your consumer to expect them, right? And so how does that change their behavior? Is someone only going to order from your service when you send them that email with free delivery? And if that's the case, is that the kind of behavior that we want our consumers to exhibit? No. And so I think being able to recognize that and segment your customers according to their ordering behavior, their order frequency, and their response to promotions can help you better understand what is the best strategy to take when it comes to pricing.
I mean, I could teach an entire course on what Jessica just said. So let me just say a few highlights for everybody. Number one, she's talking about something right. In other words, the minute you say long-term in marketing, of course, I think of customer lifetime value. So you shouldn't just be thinking about the short-term effects of pricing. You have to think about the long-term. Because, of course, the old marketing adage, the only guarantee you get when you lower price is lower margin. You have no guarantee that you're going to get anything else, and so you have to think about the long term, which is why I loved what you said about you have to measure other things than just short-term conversion. Because most time, that's ROI negative. That's the first thing. The second thing, there's always the famous quote of marketing, once a switcher, always a switcher. If DoorDash can get someone to come in the door by offering a lower price, so can their competitor. And so, again, thinking about running experiments where you track people over a long enough a time is a very important thing for all firms really to think about. I saw a lot of other hands up and questions.
I think I have one follow-on comment. I think there's a kind of to the extent the Atlantic counts as a kind of mainstream media or a watershed moment, there's an article in the current Atlantic written by Jerry Useem, a friend of Wharton's, exactly about price testing and price elasticity today. It's not the cover. The cover features, I think, Alec Baldwin portraying our fellow alum, but that's the issue. And there's a lengthy article on exactly this, deriving price elasticity. So it's actually kind of a big moment for analytics and price testing that this is now kind of hitting the mainstream.
It's great. Gentleman right next to you. Yep, I saw his hand up before.
Hi, my name is Andy Ruan. I'm an Wharton alumni. And my question is to all of you, and retail obviously is a big user of customer analytics. So what are they doing wrong that they're having so many problems?
Now, do you mean brick and mortar?
Correct.
So maybe each of you could talk about what you've seen in brick and mortar. Because let me just say, by the way, it's the fastest growing area of analytics. So I don't know, Krista, maybe we could start with you. So brick and mortar analytics.
Yeah, sure. So online to offline, offline to online, big topics these days. I think that it's typically very hard in brick and mortar to do analytics right, but there's a lot of signals that we're starting to collect as an industry. So, store tracking people foot tracking when they're coming in and out of the door. I've seen a couple cool models where they're actually tracking users throughout aisles. I think Home Depot does something really cool where their app, you can look something up on their app and it'll actually tell you the aisle and exact location in the store of the thing you're looking for. And so the app actually serves as a map and a guide for the user in store, as well as then helping them to attribute a sale back to the use of that app. So I think that's really cool. one thing that I know we do is something called the measurement protocol, where excuse me, businesses can send offline hits back into Google Analytics. So if you have like a point of sale device or something that's digitally connected, you can send that data back in. You can tie it, then upload offline data for user behavior and kind of tie it all together with your online data. If you have some kind of a user key, the user key part is hard, and not all businesses have that. So I think we're having, as an industry, to get much more creative there, which is why I like things like the Home Depot example.
Yeah, RFID is really changing brick and mortar retailing. And Ethan, when Krista was mentioning about in-store path, the reason Ethan was nodding his head, I spent 5 years working with in-store path data. So if you want to learn more about it, just type, I don't get any money for this, so there's no self-promotion going on here, except it might double the number of people that have read my articles. If you type Eric Bradlow Path Tracker, you'll see a bunch of stuff I've done where we actually collected in-store path data and how firms use them for business intelligence and monetization. And so there's a lot of stuff being done today. As Krista mentioned, foot traffic, your cell phone, of course, is a tracker, and so you connect onto the Wi-Fi system of stores. So a lot of that information. Brick and mortar retailers are not as dumb as you think. And a lot of the innovation is now coming there. Other hands up? Yeah, please, over here. Thank you.
Hi, my name is Bianca Gonzalez. I'm a nursing 08 grad, and I'm entering Wharton MBA here at San Francisco in May. And my question, I guess, is for all of the panelists. I'm currently a co-founder at an very early stage digital home health startup with 5 employees, and currently at an accelerator here in SF. How do you build a culture of analytics with very limited resources, with only 5 employees? And what tools should we use? What pitfalls would you say we need to look out for? I know about the HIPAA and IRB compliance issues that collecting data, storing data, transmitting data can have in this space. But how do we collect data on what's really important in patient care, like falls, ER admissions, infection rates in the home care space? How would you recommend we go about this at this very early stage?
Any thoughts, Ethan?
Yeah, it's obviously, it is your business to have this data and so working with customer level data in healthcare is difficult because it's regulated under a couple of acts and one regulation primarily called HIPAA, which she mentioned. And so, it is just certainly acknowledging that it is your business and you can't not do it. And so it's a big cost and, in some ways tax on doing your business. And I think also, acknowledging that's going to be an important part of the culture. And then probably you implied it was a services business, which sounds like it has some logistics components, maybe more along the line of what Jessica works with. Making sure that you actually have secured access to the relevant data is also really important over time. So if you have a claims feed, for example, that's coming in, and if you're not generating the data and you're getting these claims from some other source, that you have access to that source for the long term is also a really important part as you kind of implement this culture of analytics and this data. There are lots of cases where somebody has a special deal from a data provider in healthcare. I saw some of them also on the list here of attendees, and then come in year 2, like that data provider has done a deal with somebody else, and then that data flow is turned off. So I'd say it's another important part, in particular in healthcare, or maybe even we could generalize it to if you don't control the source of your data, making sure that you have that for the long term and not just sort of for the. I know you're thinking like, geez, I can't even keep this thing going for 6 months, but you got to start thinking about 6 years now.
It's interesting, your question also reminded me, about a year and a half ago, we had at Wharton, Philadelphia, a speaker by the name of Gary Loveman, who's the former CEO of Caesars Entertainment Worldwide. And he was asked that exact same question: how do you instill a culture of analytics through the employees? And he said it's very simple. I told everyone if they don't use analytics to make decisions, they're fired. He just said, I just fire every single person that's not willing to use analytics for decisions, and then everyone else got the idea that I was serious. So, hopefully you're in a position well, you said you're a small startup, so hopefully you're in a position to influence the people that are hired and to have them make empirical decisions. And of course, it's very easy to do. Just hire all Wharton people, because that's our brand. That's our brand. That's what we're training people in. We have time for maybe a few more questions, maybe here up front.
Hi guys, I'm at Uber, so we have a ton of data. I'm on the fraud analytics team, and we decide—
The what analytics team?
Fraud analytics.
Fraud analytics, okay.
So we decide who not to dispatch rides to. So we're looking at a ton of user behavior data and payment information. How do you guys recommend setting up like a clean data source? So making sure your features are clean, making sure your models can interact with the data, making sure that you're defining the values you want to see.
I guess this one comes to me.
Sure.
Yeah, so I mean, that's a fantastic question, and that's a question that I literally sat in a meeting today to talk about, so it's very relevant. I think for us, it's a lot of, test and iterate. So whether it's determining whether or not a feature is valuable, give it a try, see how it performs, see if it improves our models, and look at the trade-offs. So with regards to fraud, right? So we have a certain threshold with which we will, as well, for us, it's decline a transaction or deactivate an account. And so where you set that threshold is always a big question, right? Because you have to look at your false positive rate. You don't want to be turning away legitimate customers because you think they're fraudulent, neither do you, right? But you, at the same time, you have a financial exposure if a transaction is fraudulent. And so I think for us, it comes down to the trade-offs you make between, what you're willing to lose against, or sort of what you're willing to give up and what you're willing to lose. And then when it comes to defining specific features, a lot of it comes from data consistency and data integrity. And so we actually have someone on the team whose sole responsibility is to make sure that our data is clean, consistent, and accessible. And to work with our engineering org and our product org so that when we are building our models and defining our features, we know what we're looking at, and we know that the data is clean. We understand what the outliers are. We understand where the limitations are, so that we can take that sort of human understanding and put that as best we can into our models, right? Because a model doesn't understand what your data means or why something might look the way it does, but a human does. And so I think having someone who is responsible, sort of a data czar, if you will, it's kind of the nickname we gave, but someone who's responsible for the data integrity and making sure that revenue in our database is revenue for everyone that accesses it, right? So if I ask someone on our sales team to pull, their revenue from the merchants that they sold, that number should match exactly what our finance team pulls for revenue by sales rep. Even if it's coming from different tools or different systems. And so having that consistency and that cleanliness is really what makes your models perform, because you can build the best model in the world, and if the data that is underlying to that model is incorrect or is dirty or is too small, your model's not going to perform.
Yeah, it's a great question, because large-scale fraud detection is every company's business that deals with large number of customers, especially in the service business. Every company I've ever worked for of that scale has some sort of automated fraud detection system. So that's a great question. Other questions that we have for our panelists? I see a few more. I don't think we're going to get to all of these. I saw right here.
Thank you. My name is Malika. And I have a question around something this gentleman had said previously. So it's never clear which function defines what data to collect. Business often says, oh, it's a product problem. Engineering says, no, it's an engineering problem. Do you have any thoughts around that? And secondly, one of you mentioned about experimentations. How long do you run this experiment? What is is it a kind of time period that one sees ideal to run these experiments to collect the right kind of data?
Krista, please.
Yeah, sure. In terms of who owns the data or who should be thinking about it. I think that's really business dependent. There's a lot of different models out there, hub and spoke, or every team has their own data centers of excellence in big companies. So I think it comes down to organizationally how you're set up. But I do think that you need some kind of a central team, whether it's central for the whole company or central for a product, that will own and care about the data across the whole funnel. I think that you run into problems with data integrity and consistency when you have marketing owning their set of data and product owning their set of data and sales theirs, and there's no communication between the two. In terms of experimentation, best practice will generally be running a test for 2 weeks, and that's to account for week-over-week changes. You also need to think about seasonality, and if there's a holiday during your test or various things, you may end up running it for longer. But again, it's also going to depend on the amount of data you have. I think I mentioned that earlier. So if you don't have a ton of data coming in, you may need to run it for longer to be able to get statistically significant results. One last thought there. You may also find that it could be relevant to run it for shorter periods of time, especially if you're in publishing or something like that, where the article relevancy is only relevant for a day or a week. And so those kind of companies might have shorter windows. It really is business dependent.
So maybe just to be respectful of the time of the people that have to leave. By the way, after the question and answer period is over, there's recepting, if that's even a word, for like 20 or 30 more minutes, so there'll be time to ask the speakers questions. So I think we have time maybe for one more question. Please. That was a quick hand, so there we are.
Hi, I'm Clint Weiler. I'm halfway through the executive MBA program. So the thing that comes to my mind are the people that I've worked with that were majority owners of companies, small. There's lots of other projects available to allocate money to. So if you were 100% owner, how would you sort of look and you also decided, I'm going to also be the data scientist. How would you look yourself in the mirror to say, this is worth doing instead of XYZ project that's more like product development or whatever? Like, what are the guardrails that you put onto these things so that you're not just chasing a rabbit down a hole?
So it's a good question for me. This is a question I think is great for all of our panelists. Like, how does DoorDash decide how much to spend, if you'd like, on data infrastructure and data science? How did you guys think about it in Castlight, and also Ethan, all the companies you work with? And well, Google has unlimited money, but of the unlimited money they have, how do they choose how much to spend on? What's the ROI of data science, if you'd like? So maybe Jessica, we'll start with you.
Yeah, so my answer will be quick. You mentioned that there were, project A, project B, project C that you could do instead of sort of data. And my question back to you would be, well, which one, what's the impact of project A, project B, project C, and project D? In my experience, in order to quantify that impact, you actually need the data. So you can't make those kind of decisions and you can't make those kinds of investments without the data to be able to answer that. So first, it may not be super sexy, but first set up the plumbing and then get started kind of building your house. And so that's at least my advice to myself, I guess, if I was an owner.
I think it relates also to your opening remarks about, well, what is the business problem you're trying to answer? Like, in other words, data science, unless that is your business, that's not a business problem. I mean, that's not the business problem. The business problem is, how do you set a price? How do you decide to make the green or the red button? That's a business problem, and data science will help you solve that problem. And hopefully that has an ROI to it. Mm-hmm. So Ethan, what are your thoughts?
I have kind of an emotional, or maybe an appeal to emotions, where it's kind of like, how painful is it to you as an entrepreneur or 100% owner not to know? And so for some, it's not painful at all. These are people who, prefer not to know, right? And that's a certain kind of entrepreneurial, often occasionally celebrated entrepreneurial. And so, and in that sense, like, they're not going to want to spend money. And then the other hand is like, I prefer to sail with whatever, a map and or stars or something, whatever people sail with. And like, isn't it nicer to know those answers? Doesn't it feel better to be able to answer questions? And how much better does it feel? And that kind of says like how much relatively to spend on analytics.
How about?
Yeah, so to my core, I strongly agree with Jessica. I think it is fundamental to everything you do. That being said, I have seen many cases and had to do it myself where you have to make the tough call that something has to ship and you need resources there versus spending it to implement. And you just have to do it sometimes. And it's unfortunate, and that means you're not going to have the data to be able to report on that. And hopefully in a cycle, not in the too long-term future, you'll be able to go back and add that tracking and get up to speed. So even though I vehemently believe that data is important to everything, I understand the trade-offs sometimes. I don't think there's like a right or wrong answer. In this case, to always do one thing or always do the other, I think you have to evaluate what is the right thing to do for your business at that moment. And it might sometimes, unfortunately, be delaying the data, even though that's not what I advocate for.
Well, so that ends the Q&A period. Just to remind everybody, there will be additional reception after the event. On behalf of Penn Wharton Entrepreneurship, Irina, thank you. On behalf of the Wharton Customer Analytics, Colleen, thank you. Of course, Rachel Dirksen, who helped set up this event, thank you very much. Thanks to all of you for coming tonight. And of course, most importantly, let's thank our panelists, Krista, Ethan, and Jessica once more.